Joining me now in the studio is Detlev Ganten. He's a professor at Charité, Europe's largest university hospital here in Berlin. A warm welcome to you, Professor Ganten. Now, we've seen life expectancy has been increasing over the past decades, but what we heard from the report and the dire results of climate change, are we going to see this trend reverse?
Well, definitely. There is a danger, and indeed there has been great progress in the past, but this came at a cost. And we have been using natural resources, and we have been overheating the planet. And this, of course, has consequences. And as we have seen, children are the most vulnerable, so they suffer the most, and the old people.
And will it make a difference where these children are and which part of the world they are living?
Yes, the world is not equal. And there are certain areas in the world which have not benefited from the progress, and that is Africa, of course, it's South America, it's parts of Asia. And there we will have to have major attention that these are not, suffering too much, and that we kind of continue our progress at the expense of other regions of the world.
Now, you talked about children as well as old people being worst affected by climate change, the most vulnerable parts of society. In the past, we've made so much progress in medical terms. Can we kind of talk our way out of this crisis, doctor our way out of the crisis?
Medicine can help, and we do have to help. But health is more than medicine. And medicine is a social science, by the way, and we'll have to see the holistic picture of climate change and where it comes from. And doctors have a responsibility to look at beyond what they do in their daily practice. They have to look at the conditions we live in, and that is very important.
But our environment has been deteriorating for decades. For example, I'm sure my grandparents or my parents lived a healthier life than I'm leading now, and that will continue. But somehow the body seems to have adapted to these changes. Do you see that happening?
No, the body will not adapt. I mean, we can protect ourselves if we have the means to do that. And your grandparents, there were about 1 billion people on Earth. Now we are 7. Soon we will be 10 billion people on Earth. So the problems are increasing, and it's speeding up, and we'll have to cope with it. And this takes more measures than what has been done 100 years ago.
Now, you had the World Health Summit, which took place just a couple of weeks here in Berlin. Climate change and its impact on health was top of the agenda. What kind of policy decisions did you come up with which should be a priority to combat this?
The most important is health in all policies. It's not just health, it's security. I mean, if there are floods and so on, then, there is all kinds of things happening. So securing forces have to be there. It is foreign policy. We have to look at other regions of the world. It's the economy. We cannot have always increasing economy and wealth in some regions at the expense of others and using all the natural resources. So the governments have to really look at health and well-being of people in all areas of governance. And the other point is universal health coverage. We need health coverage and taking care of people all over the world. This is not the case at the present time.
Absolutely not. And for example, we were just looking at in Delhi, the schools were closed there because of high smog. How important is local action to protect children from the effects of climate change?
Well, local action is important. And of course, children, these are toxic gases. They hurt the whole body. It's nanoparticles. They go everywhere in the body and has long-term consequences for a child. But they come from somewhere. They may come from Delhi, but they come, with the winds, they come all over the world. So it's not just one region. It's the whole planet. It's planet Earth, which we have to protect. And the Sustainable Development Goals, actually, decided by the United Nations, going from no poverty, no hunger to education and partnership for the goals. I think working together in governments, but worldwide, that's what's required at the present time.
So a lot of work still to be done. Professor Detlev Ganten, thank you very much for sharing your expertise with us on DW.